Millions of seniors are relying upon Medicare, Parts A, B, and D. But there's more to Medicare than just Parts A, B, and D. There's the Medicare Advantage plan. So this is part 2 of our Medicare Health Insurance Explained, and we're going to take a deeper look at the Medicare Advantage plan. So stay tuned. Thank you for watching. This is Richard with Wisdom Investor. Social Security COLA, the cost of living increase for 2020, has gone up 1.6%. So Social Security participants will get an increase of 1.6%. Now, in addition to that, Medicare has also gone up. The average Social Security person will receive an extra benefit of about $23 per month, but Medicare is also going up about $8 per month. So we're going to take a look here today on some of the basic cost of Medicare Advantage plans and how these plans work here in 2020. Okay, in this video we're going to diagnose and break down the Medicare Advantage plans. We're also going to compare that to the original Medicare. So on the right hand side of the picture here is Medicare Advantage plans and what they are composed of. And on the left hand side is the original Medicare. Original Medicare is made up of Part A, which is hospital, Part B, which is mostly doctor type expenses. Part B, there's a cost, $144. If you make over $87,000 per year in 2020, that's going to go up. And then there's a cost for Part D, Medicare insurance for drugs. If a person wants to add some supplemental coverages for the original Medicare, they can add supplemental coverages. And of course, there's an additional cost for that. So for original Medicare, you're going to pay the $144 or a little bit above, depending on your income, plus Part D if you're having drug coverage, and then a little bit more if you have supplemental coverage. Medicare Advantage is a package. It consists of the Part A, the Part B, and the Part D. There's also some extra benefits that could be involved, such as vision, hearing, dental, and more. And also, there's some options here to help lower out-of-pocket expenses or costs. The Medicare Advantage plan pricing, you're still going to pay the Part B just like you do in the original Medicare, which is $144.30. And if your income is higher than that, it's going to be higher. You're still going to pay that portion. Plus, there's a extra amount that you pay for the Medicare Advantage plan. That can run anywhere between $0 to $200, with the average being about $30. There's various packages and plans for Medicare Advantage depending on where you live. Each area has a different plan. Keep in mind, over here on the original plan for Medicare, Plan A, there's no cost for that, but that's only hospitalization. So almost everybody needs to add the Plan B. Okay, let's look at some differences between the Medicare Advantage and the original Medicare. Medicare Advantage, in most cases, you need to use the doctors who are on the plan's network. It's more like a PPO and an HMO setup. You also may need to get a referral to go to a specialist. In the original Medicare, you can see any doctor in the United States that's handling the Medicare, and it's taking Medicare. And you don't need a referral or specialist. Let's look at some of the costs here for original Medicare and Medicare Advantage. In a minute, I'll go over some various packages in my particular area on the Medicare Advantage and see what the costs look like and the differences. In Medicare Advantage, the out-of-pocket can vary. You also need to make sure that you understand that you still pay the Part B of Medicare plus whatever the premium is going to be for the Medicare Advantage. Let's look at the Medicare Advantage cost on yearly limits. You are capped on your Medicare Advantage plans. So once you reach your plan's limit, you pay nothing else out of your plan. Now on the original Medicare, there's no yearly limit. So that's an advantage for the Medicare Advantage. Keep in mind too, we haven't talked about it in this video, but there's also what they call Medigap supplemental plans. You cannot combine a supplemental plan with Medicare Advantage. To help control some of your cost out of pocket, for the original Medicare, you can add a supplemental coverage or the Medigap policy to help reduce some of your out-of-pocket expenses. The coverage for Medicare Advantage plans is going to cover what Medicare A and B covers, plus there's extra benefits such as dental, eye exams, vision, etc. Also, prescription drug coverage is included in most Medicare Advantage plans. The original Medicare A and B is going to cover medically necessary services, hospital expenses, doctors' offices, etc. And if you want a drug plan in the original Medicare, you would pay extra for that. As far as travel, Medicare Advantage typically does not cover outside the U.S., but there are a few plans that do offer some benefits. The original Medicare, you're not going to get coverage outside the United States. Let's take a look at a couple examples of Medicare Advantage plans. This one here happens to be AARP, Medicare Advantage Walgreens HMO. Here's some of the features. Zero premium, zero primary doctor copay, and a $50 specialist copay. What does it cover? Drugs, hospital medical, dental, vision, hearing, fitness, benefits, mental health care, chiropractic care. If we look a little deeper into this plan, you're going to see that the out-of-pocket maximum is $5,900, and there can be some inpatient hospital coverage charges here. And then against there's prescription drug coverage. You can see there's a copays on the prescription drug coverages, and then there's various other coverages that are part of the plan. Where you're going to see a difference in these, even though it has a zero cost per month, there still can be some maximum out-of-pocket expenses in this particular plan. Let's look at the second plan here. We can see that it's $32 per month premium, zero doctor copay, $35 specialist, covers drugs, hospital, medical, dental, vision, hearing, fitness benefits, over-the-counter benefits, transportation services, mental health, chiropractic. So we get a little expanded coverage. We're paying $32 per month. Since we're paying $32 per month, the out-of-pocket maximum is less than the previous one that we saw. This is $5,000. And then we have various circumstances here for inpatient hospital coverage, and also prescription drug has a deductible of $50 and various copays. So you can see there can be some variation in whether you pay a zero premium or a small premium. So we've been looking at the Medicare Advantage plan. It's a package of the original Medicare Parts A, B, and D with extra coverages here. We've looked at some of the costs of the plan, so it's very important for you to study what is going to be best for you. So I want to thank you for watching us here today in our Medicare Health Insurance Explained, covering the Medicare Advantage for 2020.